Good afternoon, and thank you for attending our second webinar in our upcoming series. Today's is titled Waking Up Tired Eyes. This is Dr. Harold Kaplan, the doctor for faces in Torrance, California, and I want to again thank you for sharing some of your lunch time with us. Just to give you a brief biographical sketch of who I am, I grew up in Chicago, attended the University of Wisconsin for undergraduate, and then returned to Chicago for medical school before coming out to UCLA for 5 years of postgraduate surgical training. Over the years, I rose in the ranks to become associate professor of surgery at UCLA, and for over 20 years was director of resident physician training in facial plastic and reconstructive surgery at Harbor, UCLA. I'm board certified by two boards, the American Board of Facial Plastic and Reconstructive Surgery and the American Board of Head and Neck Surgery. I've been here in Torrance for over 30 years in private practice, and I'm on the staff of the two major hospitals in the area, but more importantly, my in-house surgery center is accredited by AAAHC, the largest outpatient accrediting organization in the United States. So, what do we plan on covering today? Well, we'll talk about what are the different types of procedures that wake up tired eyes, sagging brows, under eye bags, wrinkles. Are there non-surgical alternatives to refresh my eyes? And we'll get to that later as well. What's the Revitalize Lift and who's a candidate? What age is it time to consider having some of these procedures, such as Revitalize Lift? How long do eye procedures take and what's the recovery time? How long do the results last? How much do they cost? What are the risks? How safe are these procedures? And how do I find a reputable surgeon? So let's talk first a little bit about the anatomy of the orbit area. So if you were to look at a skeleton, you would see two large holes. But if you look at a living person, you don't see anything quite that large because that orbit cavity is filled with an eyeball, an optic nerve, some little muscles that move the eye, but the vast majority of it is filled with fat. It's packing material. It keeps that fragile organ safe. And in various people during the course of their life, sometimes very young, but more so as age ascends, these little fat pads can protrude. We call it pseudo herniation, but they make these little bags. So let's start talking about some of the procedures that we can do to alleviate these problems. And the lower eyelid lift is called a lower blepharoplasty. And here's indeed a young person. She's 25 years old. So this isn't making her look old. You're not old at 25, but indeed she has bags. And so she underwent a procedure called lower blepharoplasty. And she doesn't look any younger, but certainly the bags are gone. Here's a woman in her 40s. This is a very attractive eye, and if you look at the preoperative view, you can see that something's blurring the attractive nature of that eye. And here she is after, again, a lower blepharoplasty. And you've got to admit that that is a more refreshed and vibrant eye. And here she is on a side view. So where's the incision for lower blepharoplasty? Well, we've sort of tickled this in with a little white line, and it's placed immediately under the lashes, as you can see here, about the place where somebody would put eyeliner. And there's another example of a different technique down here where if it's just a little bit of fat but no stretching of the skin or laxity of the muscle, you can make a little incision inside the eye, but it's only adequate for removing a fat pad protrusion. What about upper eyelid lifts, what we call upper blepharoplasty? Here's a gentleman that there's something not quite right here. If you look, you can see that his upper lid is literally being supported by an eyelash. Now, an eyelash is not a support structure, so this thing is definitely hanging down and making him look quite sad and tired. So here he is after an upper blepharoplasty, and you can see now what we've created is we've got a natural skin crease up there, which makes that eye look more alert and refreshed as well. So where's that incision? Well, as you can see here, it's in the natural crease. And as a matter of fact, when this eyelid opens and folds up, that incision's hidden. And even while in the first few days, while there might be some sutures still in the upper eyelid, nobody could see it. And when you blink, the blink is too fast for them to see it. So this conceals very quickly shortly after surgery. Well, if you've got two eyes and you've got an upper and a lower lid, 2 times 2 makes 4. So there's a procedure called quad blepharoplasty. And here you can see heaviness of the upper lid and definite fullness on the lower lid. And here she is after what we call quad blepharoplasty. Here's another patient. And I think on this view you can see the heaviness here and fullness down here. And here she is after her procedure. And I've always liked this slide and I always put it in because it looks to me like she's checking herself out on the before and afters. And you can see improvement on this view as well. So what have we done with quad blepharoplasty? Here's the upper incision, there's the lower incision, and one on each eye. About 10, 12 years ago, I started looking at results of forehead lifting, brow lifting, and saw that there was an evolution from what we had seen for many years, which seemed to be very much overdone work. People had that startled look, the deer in the headlight look, and there had to be a way to get a much more natural looking brow lift. And at the same time, endoscopic brow lifting was coming in. And I felt that we could modify it further to make this a more effective procedure. So what the modified brow lift is, a simple, fast, economical, reliable procedure, because I found that my patients were coming in and they were looking for minimal incisions, minimal downtime, and minimal discomfort. Well, that all makes sense. However, the problem has to be of a certain level, because the caveat is minimal surgery can also mean less result. Well, in some situations, less result is actually a better circumstance, but you've got to match the solution to the problem Now, in general, concepts in brow lifting, people come in and they say, I've got sad, tired look. People are inquiring at work if I'm okay. Other people say people think I'm always angry or frustrated. So the desired result is really a more alert and refreshed look with a relaxed forehead, not necessarily a significantly higher brow or a tighter forehead. So the brow lift is really about the eyes, and sometimes we have to do a combination of brow lift and blepharoplasty to solve a problem. So let's go through a few people. Here's a lady that I think you would say there's heaviness, also not symmetry because the two eyes are different. And here she is after what we call a modified brow lift and upper blepharoplasty. So where are the incisions? Well, the original evolution to smaller incisions was the endoscopic brow lift, and there were actually 5 incisions. There were the 3 that I'm showing plus 1 on each side additional. And I felt that we could do this through 3 limited incisions. This is about a 1/2 inch in the hair. This one's 3/4 of an inch on each side. We don't shave the hair, and these incisions just heal up in the scalp very nicely within the hairline. Well, as we were evolving, we started saying, well, what about the concept of doing several smaller procedures, and sometimes 1 + 1 could equal 3, or 1 + 1 + 1 could equal 4. In other words, you could potentiate the results, and that's what became the Revitalize Lift. So here's a woman that you can see there's definite heaviness above the eyes and fullness below the eyes with laxity of the skin in the under eye muscles. And here she is after the Revitalize Lift, looking distinctly more alert and refreshed. This is a lady that came in and said, everybody at work says I'm angry. And I think if you look at this pre-op picture, she does look kind of upset. And here she is after a Revitalize Lift and a couple other little procedures. But she was a delightful lady, very upbeat and happy, but that pre-op view really didn't make that the case. And I think after surgery certainly looks refreshed and a happy camper. In this slide, what I want to show you is, you see what's going on up here? See all these horizontal lines? That's called work. That means these muscles here are working really hard to lift the brow. And then they get this look of, it's kind of a stare, glare type look. So here she is after a Revitalize Lift, which is combining the modified brow lift with the upper and lower blepharoplasty. And if you look here, the forehead's now relaxed, and the eyes don't look like they're working that hard. And here's a side view of the same lady. So the Revitalize Lift, now we're combining 3 little incisions up there, 1, 2, 3, 4 little ones down there, and we can achieve quite a bit through these limited incisions. So what are the advantages? Minimal incisions, it's simple, it's fast. We can do Revitalize Lift in 2 hours or less. It's economical because we're not using all sorts of elaborate equipment and supplies. It's remarkably reliable because it's very difficult with this limited procedure to overcorrect. So we rarely can elevate a brow more than 3 to 4 millimeters, and I virtually have never seen anybody get it up to 5 millimeters. Recovery time's quick. We're not using any tissue glue, we're not using any plastic or wire devices to support the brow. And most importantly, patients really like that not having that deer in the headlights look or that harsh look. And I would say in consultation, that's the #1 concern expressed by my patients. So let's talk a little bit about the non-surgical alternatives. Frequently somebody comes bopping into my office and says, my daughter's getting married in 3 weeks. What can we do? Well, certainly you're not about to do surgery 3 weeks before your daughter's wedding. So what can you do for quick fixes? And one of the things are what are called neuromodulators, better known by Dysport, Botox, Xeomin. And these are products that block muscle action. And they can be used in some instances to do what I call a chemical brow lift. Whereas with a surgical brow lift, if I can elevate the brow 3 or 4 millimeters as a desired result, I can get 1.5 millimeters of lift with these injections. You can also use them in the frown line area, you can put it in the crow's foot area, you can put it in the forehead in those horizontal lines, and it's a quick fix, but in 3 months it's gone. So it doesn't have the longevity that a surgical procedure would. The other thing that can be done around the eyes, but very carefully, are injectable fillers. Products like Restylane, Belotero, Perlane, Juvederm. But you've got to be cautious with fillers around the eyes. You don't want fillers in the forehead. You don't want fillers in the crow's feet because you can see them. The most ideal place for a filler is underneath the eye in a place called the tear trough. So if you had a little tear in your eye and it ran into the inner corner of your eye and ran down your cheek, it goes down a little diagonal groove called the tear trough. And where you have that indentation, you have fullness above it, you have fullness below it, and that draws attention. So you place the filler into the little groove or the tear trough. And that can be a very pleasant result, but again, the maximum duration is usually about 6 months. So let's deal with a few of the more common questions. Who's a candidate for a Revitalize Lift? What age is it time to consider having it? Well, for example, earlier I showed you a 25-year-old. So this isn't necessarily age-related. As a matter of fact, in my practice, I wind up doing more procedures around the eyes than any other area because it can affect people in their 20s, 30s, 40s, 50s, all the way into the 80s. So you're a candidate for these procedures when the problem is there. So it isn't necessarily age-related, although we see as a decade or two go by, the problem will worsen. But it's when it starts to bother you that you become a candidate to come in and talk about it. How long do these procedures take? Well, for example, just an upper blepharoplasty or eyelid lift, 35 minutes. A lower blepharoplasty, maybe 45 minutes. When you combine them into a quad blepharoplasty, there's an economy of scale, and it's about an hour. A modified brow lift by itself takes about an hour. The Revitalize Lift takes 2 hours or just under 2 hours. The type of anesthesia used is dependent upon which procedure, because the Revitalize Lift taking a couple hours, it's kind of hard to stay still that long. So in those cases, we'll have a board-certified anesthesiologist, a physician, who will start an intravenous and use intravenous propofol, which allows you to sleep pleasantly through the procedure, but we don't require a tube being placed in your throat and hooking you to a ventilator, which would be a general anesthetic. So that type of anesthetic is much safer, and recovery afterwards from it is easier. If you're just doing eyelids, oftentimes we'll put an intravenous in and give you a little bit of sedation. And for shorter procedures, it just takes the edge off because we're injecting a local anesthetic and numbing up the whole area anyways. Now, in general, recovery time for all of these procedures comes down to about the same 1 week, whether you do 1, 2, or all 3. And most people on day 3 or 4 are out and about. A pair of sunglasses can cover up. But most importantly, how long do these results last? And this is probably the best value in plastic surgery because typically in a younger age group, eyelid and brow procedures can last 20, 25 years. In an older age group, maybe 15 or 20 years. But these go the distance, so they're a great value. Now, everybody wants to know about cost, and let's run down the list real quickly. Lower blepharoplasty, the surgeon's fee is $2,500. Upper blepharoplasty, it's $2,200. Quad is $4,100. Notice there's a savings. Modified brow lift by itself is $4,000. And a revitalized lift, which is a combination of all these procedures, is $7,000. Additionally, there's an operating room charge, which for the shorter procedures is $1,600. For the longer procedures, $1,900. And if an anesthesiologist is required, if it's a 1-hour procedure, it's $520. If it's a 2-hour procedure, it's $720 for the anesthesiologist. What are the risks? Well, we talked about anesthesia, and probably that's the most significant risk because these are very minimal procedures. But everybody talks about, oh, what about vision? This is eye surgery. Well, it's not really eye surgery. It's eyelid, it's eyebrow surgery. Everybody mentions the possibility. I've been doing this over 40 years now, and I have never seen a person lose their sight. I think the risk factors are more likely to be nuisance things like numbness around the area, which can last for several months, some persistent bruising that could last more than a week, or a hematoma, which is an accumulation of blood in the area which can be quickly drained out. So I think these are considered to be very low-risk procedures. So, factors in selecting the best surgeon. Well, I've always been biased about the guy in the upper left because I've got experience in the procedures you're interested in. I've solely done surgery of the face and neck. Patient satisfaction and success rate go together. Can anybody be 100% successful? Absolutely not. We can come close, but you can get closer if you have a willingness to stand by your work. And if somebody needs a minimal revision, take care of it for them. Training, As I mentioned earlier, I spent 5 years of postgraduate surgical training exclusively in the head and neck and facial plastic surgery. There are other surgeons that spend 2 or 3 years doing uh, body work, breast work, hand work, and facial work, and I think that dilutes out the experience. But I think board certification is a minimum standard, and you need to be in the office of somebody that has that type of certification. If you're not, I think you're taking a risk. I chose to teach for a long period of time because I felt that made me a better surgeon. The people that I was teaching were postgraduate surgeons in their 4th or 5th year of surgery training. Incredibly bright people asking challenging questions, and they really put you on your toes. And I think anybody who teaches knows that as you teach, you learn. So I found teaching to be very, very rewarding in a number of ways. I've had the respect of my peers over many years and have been honored and privileged to have doctors, nurses, and their family as patients, and it's quite humbling. But at the end of the day, it's the integrity, honesty, and respect for you, the patient, of the surgeon you choose that I think is very important. So we're going to do some Q&A. Some questions have already been submitted. You have an opportunity to submit questions on the screen on the right. And if we do run out of time, I promise you we'll email you a prompt answer. Don't forget to schedule your complimentary consultation. We'd be delighted to see you and talk to you about your particular issues, because what we just did was a generalized overview, and we have to design something that's very specific to you. And there's nothing wrong with looking beautiful and refreshed in all the holiday photos and be ready for that new year. So we still have some appointments available, and I look forward to seeing you, and I want to thank you again for sitting in on your lunchtime. And you can call for an appointment at 888-344-9805. And at this point, let's go to some of the questions that have been submitted. First one, the crease between my eyes makes me look tired and cross. What can I do? We talked a little bit earlier about doing what are called neuromodulators, Dysport, Botox, Xeomin, and that can really take that away for the short term, but for long term, obviously these surgeries are necessary. Can I reduce, or can you reduce the wrinkles I've had for a long time around my eyes? Again, short term, you can get rid of a lot of crow's feet with these neuromodulators. And even after surgery, when you smile, you'll crinkle. And if that bugs you a lot, a little bit of injection can soften that up for you. Under eye bags, what can I do to reduce their appearance? Well, we mentioned earlier a short-term fix was a little filler in the tear trough. But at the end of the day, the better value, because of how many years the result persists, would be to do a lower blepharoplasty. Is there an eye cream that will reduce the dark circles? The answer is yes. It can be quite effective, but if it's an extreme circumstance with lots of redundancy of skin adding to the shadowing under the eyes, a surgery would be necessary. How long will my surgery procedure last? We, I think, addressed that, about 2 hours for a Revitalize Lift and an hour for the rest of the procedures that we do. Oh, very good question. Where will I do my surgery? Is it safe? Well, in my surgery center, which is AAAHC accredited, we have to undergo the same standards as the hospitals do for their operating rooms. And it is just as safe as there, and we have all the resuscitation equipment necessary, but it's also much more private, and it's a little bit more friendly. How do I know that I will not look overdone and my eyes will work the same? Well, that is the skill of your surgeon, and somebody who's specialized in exclusively facial plastic surgery is going to know how to not produce that overdone look. And I agree with that question. And every day I see people worried about that. That's my job to make sure that does not happen. Another question was, if I schedule now, will I look good in time for the holidays? Well, Hanukkah's December 6th, so that's not going to happen. If you're trying to beat Christmas and New Year's, I think you've got to get moving quite quickly, because time is flying, and we're getting near that end of the year. Another question, how many surgeries have you done? Is experience important? Obviously, experience is incredibly important. I've done thousands of these surgeries, you have to keep developing procedures. You have to keep honing the skill. What you did 20 years ago just isn't quite good enough to be what you should be doing today. So you have to constantly be improving. Why should I choose you over others that cost less? My answer is real easy. It's your face. Why would you want to go cheap? So I want to thank you all again for attending this webinar, as well as the one we did about a month ago, and all the upcoming webinars will be posted on our website. So if you've missed something or had to tune out briefly, you can tune in and see it. It's also going to be on YouTube, so you can have an opportunity to review this information again. Have a great afternoon, and thank you very much for attending.